Hey guys, what's up? It's Maddie here. This is my 35-week baby pregnancy update. He's the size of a canary melon, don't know what those are, and he is coming in between 19 to 22 inches and supposedly around 5.5 pounds. So let's go ahead and get into it. I cannot believe that I'm 35 weeks, let alone 35 weeks in 2 days actually. I have almost a little more than 4.5 weeks left till my due date, and who knows, he could come before then, and he could come after, well, not too much after then, because I did ask my doctor to get induced, which I'm pretty sure I mentioned that. There's not much to discuss because I did do a lot of my discussion in my 34-week update that I put up really late a couple days ago on Monday. Stuff's going good. There are a few new things that I would like to talk about with you guys, but other than that, I'm doing good. I'm pretty healthy. I have a doctor's appointment and an ultrasound next week. The ultrasound is on Tuesday, the doctor's appointment's on Thursday, so the 2nd of July is Thursday, and Tuesday is the 30th of June. So I'm pretty pumped for those, and then next week starts my every 1 week I have an appointment, every Thursday. And those are all set up and ready to go. She already set them up, and then she also set me up one for 3 days after my due date, but I am going to talk to her about being induced hopefully before 3 days after. I'm hoping. So yeah, let's go ahead and get into the update. As far as symptoms, my heartburn has been horrible lately, like horrible heartburn. Almost like I feel like a log is going down my throat on fire sometimes, and it's normally obviously at night after I've eaten things that my body just doesn't agree with, and it really sucks, because sometimes I'll even get it for no reason, and I didn't eat anything spicy, I didn't eat anything that would cause it. I haven't even eaten yet today and I'll get heartburn, so it all just depends. But yesterday I had it really bad, which is what reminded me to mention it in the video. Other than that, I did want to mention this. I am pretty sure that I had Braxton Hicks contractions, like for sure, the other morning, because I woke up to go to the bathroom. Obviously, I probably wake up twice in the middle of the night to go to the bathroom, and then I go to the bathroom all throughout the day. But I had this pain in my back, and only on my right side. And normally I have a pain in my right side if I sit up too long, or if I just sleep a little off. It's more of an ache, it's not a pain. And I can tell the difference between what happened before and what I normally feel. And normally it's just my hips that hurt after sleeping because, so much weight, my hips are expanding, turning from side to side. I always have to move my weight and stuff. But this time it was, oh my gosh, it wasn't like super painful, but it took my breath away. Not in the pain wise, but in the fact that I was like, oh my god, what is this? Like, I was just having to stop and think what was going on. And the first one lasted for about 10 minutes. And then it came back about 10 minutes later and lasted only about 2 minutes. So obviously it wasn't any real contractions, because one, they went away. If they were real contractions and it was labor-inducing contractions, I would want to be in the hospital because it happened a few days ago. And 2, I would probably be in a little bit more pain. It was just something I had to get through. It was just uncomfortable more than painful. And then last night, I was having just stomach pains, and I don't know if it was Braxton Hicks or maybe something didn't agree with me, because I did have the heartburn a little bit later, or earlier than that and later than that, so it could have been tied in with that. It could have been a slight Braxton Hicks contraction. I'm not sure. I don't know if I'm ever going to be 100% sure, because when some people I know never even had them, and then other people that had them, it's one of those things that I don't think you ever really know until you have your real contraction, and you're like, oh, I got that. So yeah, I'm just patiently awaiting him to get here. I wouldn't mind if he came in 3 weeks, because if he came in 3 weeks, I would be 38 weeks. I'd be pretty close to term, and he would most likely be healthy enough. And as you guys know, according to my last ultrasound, he was already 6 pounds, or that was at 33.5 weeks, so he could very well be 7 pounds now. I guess we'll find out at my ultrasound next. yeah, I guess we can just kind of talk, what the app says, what's going on with him lately, but I don't really have much symptoms other than shortness of breath, very much so, hard to take deep breaths, hard to yawn. No one ever told me how difficult it actually is to yawn while being this far along. Like when I yawn, I feel like there's not enough room, and I'm like, ugh, when I'm yawning. And when I take a deep breath, I have to lean back a little so I can get it in. But if I'm like sitting like this, no, it's gone. Yeah. Oh, I know this part is probably TMI, but I had a lot of mucousy discharge about, I want to say 3 or 4 days ago, and the next day it was gone. It could have possibly been my mucus plug, or it could have just been a lot of discharge. I know that's TMI probably. It's probably just a little bit too much information, but I talked to my doctor about it, and she said it could have been, it could not have been. It doesn't really matter because some people don't even lose their mucus plug till they're in labor. It's not that big of a deal. So I thought it was interesting. It might be interesting for other people to know when I may have lost it. And then you know what? When I do the birth vlog or story, because I want to do the birth vlog, but all depends on my hospital. I know I can't film the birth at my hospital, but I could do some before and after, and we'll see how I feel, if my family is willing to help me film it, because obviously I can't film it while I'm contracting. So hopefully my mom and my friend will help me out. So we'll see. But I do want to do a birth story, even if I do a birth vlog, kind of just to talk about everything that goes on from the beginning to the end, if I'm induced or if it comes naturally. So yeah, let's just get into a little bit about him. It says that they won't be getting much longer at this point, and they'll be excuse me, they'll continue to pack on the pounds, including large amounts of baby fat. So that's really what they're gaining right at this point. They are gaining lung capacity. I mean, at this point, it's not ideal to have your child at 35 weeks because their lungs aren't fully developed. They very well possibly could be fine, but they very well possibly could have to be in the NICU just to help the lungs along. So obviously I don't mind that I haven't had him yet, and they're still gaining baby fat, so their bodies aren't so, I don't know, I've seen some small babies and they're so skinny and I just want some chunk on my boy, which according to the ultrasound I'm going to have a ton of chunk on him actually. There's actually, what it says is there is fetal brain development. There's a lot going inside the head, which is, by the way, still stopped, so it can allow an easier exit through my birth canal, which is actually interesting because I learned this when my friend went into labor. When you push vaginally, like when you give birth that way, the head will compress together, like the plates will push together. It'll almost form the head in a way. I don't know like the scientific way to say it and all that, but I know because she had a C-section and her baby girl did not, it just took a little bit for her head to settle down a little bit, and her head was a little bit bigger, but that very well could have just been the genes. Alright, I will go ahead and end this with a belly shot for you guys, which shouldn't be much different than Monday's because I literally did Monday's video on Monday, but you know, I'll show you kind of different top, kind of shows, I think, the belly a little bit different, so let me just stand up for you. Make sure my stomach isn't hanging out because I feel like sometimes it does. But this is my little 35-week belly. Some people say I've dropped. Some people say I haven't. I'll actually show you. Yeah, there's a hole in my shirt. Pardon me for that. I'll show you the front, which I feel I don't look very pregnant in the front. And then there's this side. And I think I look different on both sides, personally. But, hey. So, yeah. I talked a lot during that. I apologize. So, that is my baby bump. And I shall see you guys on Friday. And I can't wait to share with you guys what happens at the ultrasound at my next, at my 36-week baby update. So, I will see you later, alligator.